Alrighty, here we go. Hello, and thank you for watching this program on DCPTMD integration. There's no audio taping or videotaping allowed, and any unauthorized reproduction, dispensing, forwarding, or copying of this target coding presentation is illegal. The information contained in this presentation is for educational purposes. It should not be a substitute for your thorough clinical decision making. It's not intended to be legal advice. Target coding does not engage in providing legal services. Just a reminder that CPT is a registered trademark of the AMA, and every attempt has been made to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. Let me tell you a little bit about myself before we get going here. My name is Dr. Marty Kotler. I am a chiropractor. I had a chiropractic practice for many years, and then I transitioned it to a multi-specialty practice. I'm also certified in CPT coding. I'm a certified professional compliance officer. My areas of expertise are in CPT and ICD-10 coding, Medicare compliance, chiropractic treatment plans, record keeping, compliant cash plans, and HIPAA compliance. I've written many books and training manuals on chiropractic billing, coding, and documentation. I've also written books for physical therapists. I write articles for chiropractic economics and dynamic chiropractic, and I'm a guest speaker at many state association conferences nationwide. So let's begin today's presentation with the pros and cons of DCPT-MD integration. And there definitely are some cons to this. A lot of good things, but there are some things that you should be aware of. So let's talk about the positives. Now, overall, I think this is a very good thing to do. Overall, I think it's a way to expand your services. However, there are some things you should be aware of. You see, there are some practice management companies that all they do is MD-DCPT. So if you don't go that route, then there's no business for them. So they may paint this rosy picture and don't share with you some of the pitfalls and negatives. See, my company is different. 80% of the doctors that I work with are chiro only or PT only. About 20% of the doctors I work with are integrated MD, DC, PT practices. So out of every 10 offices that I speak to, I get calls all the time. Hey, Dr. Kotler, my practice is not going as well as I expected, or I want to expand and I want to, go into, multi-specialty. So out of every 10 doctors I speak to, 2, I tell them, you know what, it doesn't sound like it's right for you. So just make sure that you do a lot of research. Now, some of you listening to this are already integrated and you're loving it and everything's going great. There's quite a few of you on the line this morning that are thinking about doing this. And since we only have about a half hour together, I'm going to go over the basics and the highlights. So for me, the best part about going from chiro only to multi-specialty was I was able to co-treat patients with other healthcare professionals right in my practice. When you're in practice and you have a patient where there's a little bit of a question as to how to treat the patient, I would have to call a friend, or I'd have to go take a drive with the x-rays and, show them to, somebody that expert in, radiology. Having everybody under one roof was the best part about it. It adds another dimension to the practice. When I was chiro only, I was doing pretty much everything, a lot of the therapies too, and the electrical stim and the traction and the stretching and the exercises. Well, when I went multi-specialty, I didn't have to do that anymore. It took a weight off my shoulders. It's going to give you additional services. There's definitely a lot of marketing opportunities with a multi-specialty practice. Now, the negatives, there's going to be more overhead. I was just talking to a doctor recently. He said, Marty, I want to bring on a medical doctor. I said, great. He said, how much does a medical doctor cost? Based on his situation, I was calculating out it was going to be about $180,000 a year to bring on a medical doctor. This chiropractor said, there's no way I could afford to pay a medical doctor $180,000 a year. The chiropractor wasn't even making $180,000 a year. So that was the end of the conversation. He couldn't afford to bring on the MD. So there's more overhead. You may need more room. I'm working with a doctor right now. His practice is 670 square feet. He just doesn't have enough room to bring on another healthcare professional. It could be confusing to staff. When I went from chiro only to multi-specialty, some of the staff members I had with me were with me for many years, up until the integration. And now when the integration came on, there were more supervisors, there were more bosses. I had partners, so some of my staff members didn't like having other bosses, and I had one staff member quit. She just didn't like the way, the practice had changed. It could be hard to find providers and turnover. I had a medical doctor working for me for a few months, getting him in in the plans and credentialing, and then decided to quit out of the clear blue sky. It causes issues, especially in states where the medical doctor on paper has to be the owner. So overall, I think it's a great thing to do, but there are definite pitfalls and things you should be aware of. There are a lot more negatives that I can go over with you based on my experience and my client's experience, but again, we don't have enough time to go through all the positives and negatives, but overall it's a good thing to do. Now let's talk about the setup, the corporate setup. Now I'm going to go over corporate structure information with you, and again, this is for educational purposes. It's not legal advice. We don't provide legal services. The services of a healthcare attorney must be attained. Regardless of your corporate structure, you must get a healthcare attorney prior to seeing patients in your practice to discuss your corporate structure options. Even if you're an existing integrated practice, we strongly recommend you consult with a healthcare attorney to discuss your present corporate structure. Just get a little refresher. So there are three arrangements or options. I look at it this way: employer-employee, partnership and management company, and renting space to other healthcare professionals. So employer-employee to me is the most beneficial. It's the easiest to set up. It's the easiest to change. It's the easiest to hire and fire staff members. This is a situation where in many states chiropractors can employ medical doctors and physical therapists and all healthcare professionals. So in that case, the employer does all the billing under the employer's tax ID and pays the MDs and DCs and massage therapists a salary. Employer receives all the gross revenues, less the salaries, taxes, and overhead attributable to the practice. And you must get an attorney to create a comprehensive employment agreement, which is going to include all the responsibilities, the compensation, malpractice, arbitration, non-compete, non-solicitation, sick pay, vacation pay. Got to get that all out of the way. You need an attorney. Now, the next relationship is required in some states where the chiropractor cannot own a medical corporation. For example, in the state of New York, a chiropractor cannot employ a medical doctor, cannot own a medical corporation. So in this case, the medical doctor becomes the owner of the corporation, and then the chiropractor starts a management company, which the chiropractor could own, and that's how the services are provided. So in a partnership, all the billing goes under the group tax ID. All the shareholders and partners receive compensation attributable to the entire practice based upon ownership in the business. And then you definitely need an attorney to create an operating partnership agreement, which goes over the profits, losses, capital gains, taxes, day-to-day management, non-competition. That was one of the problems with, I'm going to share some of my problems that I had in my MD, DC, PT practice, so it could prevent you from having those issues. Plus, I'm going to share some things that many of my clients have had issues with. Again, I can talk to you all day about how great and wonderful this is, and I will coming up. I'm going to share a lot of great things that can occur in a multi-specialty practice, but I also want to share with you some of the things you should be aware of. So I had a partner where he wasn't doing what he thought he was doing everything he was supposed to, and it wasn't working out. So my other partner said, we have to work out an arrangement to get this one partner out of the partnership. And it was like a divorce. It was not easy. This partner thought he was doing everything he was supposed to. what happened was everything wasn't in writing. We didn't have everything written down that everybody was supposed to do. Now, the management company provides services to the medical corporation, like marketing, payroll, billing, staff management, housekeeping, and charges the medical corporation a fair market value. That should be at least 1 year in duration. The fees are set in advance. You may not be able to, you should not base it on patient volume. Again, you have to get an attorney. And to me, the easiest one, if you wanted to just start dabbling in multi-specialty, is rent space to a medical doctor or a physical therapist and see how it's going. And this is sort of like a little trial period to see if you get along, and then you can form a partnership or form one corporation. So in a rental, the MD or the physical therapist does the billing under his or her own tax ID. The MD or PT pays rent. It should be fair market value. And again, you're going to want to get a sublease agreement specifying space, equipment. It has to be for 1 year. So just be aware of that. Next, let's talk a little bit about Stark Law. So Stark Law prohibits a provider like a chiropractor or medical doctor from referring patients to an entity which you have an immediate financial relationship, or a family member has a financial relationship, and this occurs only with designated health services. One of the designated health services is physical therapy. Others are lab services, radiology services, DME, orthotics. So just be careful of that. Again, you want to check with a lawyer. Now, again, I am not a lawyer, and I don't want to give out too much legal stuff. Just like I don't like when lawyers give out coding advice. Lawyers don't want me giving out legal advice. So just be aware that, now let's say, back to, some doctors go, well, Marty, I have my chiropractic practice. I'll just start another facility, and I'll put a physical therapist and a medical doctor, and I'll just refer patients from my chiro over to the new facility. Again, there might be some safe harbors. You might be able to do it. You might be able to get around it. Check with an attorney to see how that works. But just be aware of it and make sure you're not violating it. And the other one is anti-kickback. With anti-kickback, this makes it an offense to receive payment or give payment in exchange for a patient referral. Again, there are safe harbors here with anti-kickback. So again, you want to get an attorney. Make sure. Here's a classic example. An attorney contacts you and says, hey, Dr. Kotler, I am going to send you a ton of new patients. Every time I send you a new patient, I would like you to pay me $200. See, that's illegal. And the other way around. You go up to an attorney and say, hey, attorney, I am going to refer tons of patients to your law firm. Every time I refer you a patient, I would like you to pay me $100. See, those are classic examples of anti-kickback. So you want to stay away from that. Next, hiring staff. There's a difference between qualified healthcare professionals and clinical staff. So qualified healthcare professionals is an individual who's qualified by education, training, licensure, who performs a service within hers or her scope of practice and could independently report that service. So QHPs include chiropractors, medical doctors, nurse practitioners, physician assistants, physical therapists, athletic trainers. Hiring clinical staff, that's different. Clinical staff members, this is a person who works under the supervision of a qualified healthcare professional like a chiro or a medical doctor, and who is allowed by law to perform or assist in services, but cannot report these independently. So make sure you know the difference. It's part of the definition in the CPT code book on qualified healthcare professionals. Now, there's many different types of staff members that you may be interested. When I went from chiro only to multi-specialty, I brought on a medical doctor, physical therapist, a nurse, massage therapist, acupuncturist, nutritionist. I went, all out, bringing on a lot of staff members. But you don't have to do that. you could just bring on one healthcare professional. But in general, the staff members in a multi-specialty practice will include medical doctors, osteopaths, PTs, PTAs, nurse practitioners, certified athletic trainers, nutritionists, acupuncturists, medical assistants, chiropractic assistants in certain cases. Nurse practitioners are great. Nurse practitioners, they could initiate care plans. They could administer common procedures. These are individuals that have gone through their regular nursing program, and then they've gone into complete a master's or a doctorate degree, advanced training beyond their initial professional registered nurse degree. There are over 300 colleges and universities that teach nurse practitioner programs. There are about 150,000 nurse practitioners in the country, about 190 physical therapists in the country. There are about 65,000 PTAs in the U.S. So you just want to, make sure that you check with your state rules. Sometimes it's hard to find, the rules because your state laws can conflict with federal laws. Supervision rules can vary greatly from state to state. So again, you want to check with your state board on the types of QHPs and clinical staffers you can employ and what services they're allowed to perform. Also, check with all the health plans on supervision requirements prior to billing. Inquire as to who needs to be on premises when the procedures are performed. I see a lot of multi-specialty practices taking shortcuts and having clinical staff doing services that a professional should be doing. So just be aware of that. And, while you're trying to find staff members, that's another question. How do I find a staff member? How do I find a medical doctor or a physical therapist, a PTA? There's a lot of different ways in which you can do it. First of all, ask your patients. To me, they're your best resource. Whenever I needed something in my practice or in my, personally, let's say I needed a, new carpet, for my home. If I had a patient that worked in a carpet store, I always went to my patients first. If I was looking for a new car and I had a patient who was a car dealer, I always went to my patients. So they were my best resource. But, you can contact local professional schools. So you have to have a job placement department. You can contact local medical and physical therapy offices. You could check your local hospital website and do a physician search. There are job placement sites like Indeed.com. There are placement agencies. So make sure that you if you're going to put ads in the paper, put together nice looking ads in the classified section. Take a look at others' ads. Make sure that if you're going to put a classified ad in the in the newspaper, make sure you pick the right section. When I first put an ad in, I was looking for a physician. So physician starts with the letter P in the help wanted section. Well, the first newspaper that I put an ad in, they didn't put it in the right section. They put the my ad in with all the regular classified ads. So my ad was right in the middle of all these pizza delivery help wanted ads because it was listed alphabetically. Make sure you know the right section in the classified ad. Put together something professional, and then once you start getting calls, you're going to do some phone interviews first, I would think. So you want to make sure that whoever you're interviewing, give them a list of responsibilities. Either on the phone call, let them know. There's no reason to have 3-4 interviews and then lay out what you want them to do. To me, that's a waste of time. Either on the first or second meeting with a new staff member or potential new staff member, let them know that their responsibilities could include evaluate, planning, directing, administering treatments, coordinating and delegating responsibilities, communicating and assisting with resolving problems, participating in training, understands and complies with the office compliance program and all the policies and procedures, knows the clinical rationale and how to administer the procedures, able to perform work that requires frequent standing and lifting. You may a physical therapist oftentimes has to, stand for all day and sometimes have to lift patients, so you want to make sure that person is able to perform that type of work, and they're willing to learn your computer software system. So there's a lot that goes on with that. Now you may, I get this question a lot, Dr. Clark. Why would a physical therapist, a nurse practitioner, or a medical doctor want to work for a chiropractor? Let them go have their own business, right? Well, they might not want to run their own business. They may only want to work part-time. They may well like to work in a group environment. They don't like the hospital setting anymore. They want a guaranteed income, right? Doesn't everybody want a guaranteed income? I speak to physical therapists all the time. Many of them are running their own practices. They have to pound the pavement and get new patients. And they might not like new patient marketing. So they may prefer to work for you. And you always want to, ask them how they would manage a typical case. So this is a lot of the background information. Other things here that you should be aware of. Credentialing. Do you want your healthcare providers that you're bringing on board to be in-network or out-of-network? In general, if the chiropractor's in-network with a plan, I typically recommend the medical doctor or PT also be in-network with that plan. It makes it easier for the patient. And there's a lot of things that go into, a typical patient as far as, in-network and out-of-network. Remember, if the chiropractor and let's say the physical therapist are treating the same patient on the same day and you're in-network, there's going to be 2 copays. Some patients cannot afford 2 copays. So just a couple of things here, regarding in-network, out-of-network. And there's pros and cons to being in-network, pros and cons to being out-of-network. I'm not telling you to join plans. I'm not telling you to drop out of any plans. That's a business decision you'll need to make. But if you're considering going in-network, there's credentialing. The fees are different in-network or out-of-network. Deductibles can be different. Make sure that you can charge for non-covered services. And, managed care, in-network, out-of-network, it affects all providers. Even if you're out-of-network, it affects you. So with credentialing, that's where you may need assistance helping your PTs and MDs get an NPI number, get a Medicare provider number. By the way, those are the things that we can help you with here at Target Coding. We have a small department dedicated to credentialing. So if you need a PTAN number, you need recredentialing, revalidating with Medicare, let us know. We can probably help you with that. So, there's individual managed care applications. That could be very time-consuming. Malpractice. You want to make sure that you're getting the benefits reassigned to you. Very important with Medicare. And you want to make sure you're aware of all the in-network and out-of-network rules, regulations on medical necessity, billing, and administration. Next, let's talk a little bit about patient flow. So, a new patient calls to make an appointment. Staff members should be asking, are you calling for chiropractic, medical, or physical therapy? You want to plant the seed. If a patient has been coming in for years, they know you as a chiropractic office. Now you're saying, hey, we also offer physical therapy and medical services. You want to plant the seed. You want everybody to know. You want to go through your normal new patient questions. How did they find out about you? Was it related to an accident? Now the new patient shows up. The patients have to fill out forms. Make sure you have good quality forms, nice looking forms. You might want to get them specific. If you have forms that are chiropractic specific, well, you don't want that for medical patients. And you want to make sure every new patient signs off on your HIPAA notice or notice of privacy practices. Very important. Every new patient needs to get this form. This form, if you take a look at your notice of privacy practices, if its effective date is prior to September of 2013, throw it out. You're using old information. The one I'm showing you here is the most updated HIPAA notice. If you want a copy of this, email Natasha at targetcoding.com. That's Natasha at targetcoding.com, and we'll get you this form. The patient has to sign off on this form that they've had the opportunity to review your HIPAA notice. After the patient gets their exam and history is done and maybe diagnostic tests, now you may be referring the patient to a physical therapist within your own practice. So we have a physical therapy referral or order form that we would recommend. So after you do your history exam, take x-rays, well, after wait, let's back up. After the patient comes in and fills out all the forms, now you have to start building your care plan. So that's going to include my recommendation, regardless if it's an MD, a chiro, nurse practitioner, physical therapist, this is what your care plan should entail. History, exam, come up with a diagnosis, set goals for the patient, list the services you're going to render and the clinical rationale, and come up with a schedule of care. Now, what type of services are you going to render? Physical therapy is one of the most common services rendered when a chiropractor goes to multi-specialty. Most of the doctors I work with that transition from chiro only to multi-specialty, the natural segue is to continue to treat neuromusculoskeletal patients. In my practice, I did some of that. I would say 30% was that, but my motivation was to treat cardiovascular patients when I went from chiro to MD, DC, PT. But most doctors go with physical therapy, and they have the PTs doing the modalities like the ultrasound and the traction and the electrical stim. It could be more profitable. Unfortunately, there is no level playing field here. A chiropractor could do a modality on a patient and get $25, and then a physical therapist does the same modality and is getting $65. It doesn't seem fair, but that's the way it goes. So you want to have the PT do modalities, that's fine, and therapeutic procedures like therapeutic exercises and therapeutic activities and neuromuscular re-education. You could have the PT do those services. Make sure that you're coding to the right amount of time. 1 unit is 8 to 22 minutes, less than 8 minutes. You shouldn't be billing it at all. There's a difference between total time, which is what Medicare uses and United Healthcare, and what some other regular insurance companies use will be what I call the rule of 8. So with total time, if you do 10 minutes of manual therapy and 10 minutes of exercise, what is that total? 20 minutes. With total time, you'd only be able to bill 1 code or 1 unit. With the rule of 8, you could bill both codes. So make sure everybody is trained. Make sure all your staff members, your PTs, your PTAs, that they've been trained on the proper amount of time that they're required to spend. Now you might say, yeah, Marty, we train our staff on that. Do you have it in writing? And does every staff member sign off that they understand your policy on time-based codes and how it's being billed? I get calls all the time. I just got a call yesterday from a chiropractor, brand new chiropractor. He's working in a multi-specialty practice. He doesn't think that the notes, the documentation, the way he's been trained are proper. He's been trained not to put down the amount of time with doing therapeutic procedures and other time codes. And he's asking me if this is okay. See, he's in an uncomfortable situation. He's a young chiropractor, being hired as an employee, being told what to do, but he's realizing, wait, I don't think what we're doing here is right. And the timed codes are one of the most important things to make sure you're doing right. It's one of the most important audit triggers. I'm just working with a doctor right now. Patients are getting questionnaires from Blue Cross Blue Shield. How much time does the doctor spend with you? They're asking patients. So make sure you know what constitutes 1 unit and 2 unit and 3 units. What else? Of course, you could do trigger point injections. Very common. Make sure that every insurance company that you bill for trigger point injections, get their policy. Understand what's required. Many plans will say the patient has to have chronic pain before you could do an injection. What's the definition of chronic pain? So it's in these policies. Also, DME. You may want to supply the patient with a TENS device. Sure. Also, check the policy out. What is the medical policy on TENS? Orthotics, terrific. We recommend foot levelers to our clients. Orthotics are terrific. You don't have to be in an integrated practice to recommend orthotics, but unfortunately some plans won't pay if a chiropractor prescribes the orthotic, but they will if a medical doctor does. And here's a quick example of how it could be billed. Just an example. Don't use these fees. This is just a sample for educational purposes. If you're billing for orthotics $300, you can use one line item or two line items at $150 each. Joint injections, very common in MD-DC practices, not DC-PT. Physical therapists are not allowed to do joint injections. Strapping and casting, very good services that could be reimbursed very well in integrated practices. Additional testing could include NCVs, nerve conduction velocities, and EMGs. Here are the codes for NCVs. They've changed over the years. Make sure that the medical doctor knows what an NCV is and the purpose of it. Be careful. You shouldn't just be doing tests just to get paid. Whoever's the supervisor of the test needs to understand it. Take a course on it if they're ever questioned. If you're going to have an outside company come in, make sure that person is a certified electrodiagnostic technician. And again here, make sure you get the policy on whatever test you're doing. This is Aetna's policy on NCVs. And there are tons of other items that you can do in a multi-specialty practice, like stem cells, PRP, prolotherapy, hormone injections, acupuncture, biofeedback, hyperbaric oxygen therapy, weight loss programs, nutritional consultations. Once you are an integrated practice, there are so many additional services that you can bring on board. And so many of you that are thinking about going MD-DC-PT, I hope I planted a few good seeds in your head, and you could start doing some more investigation to see if it's right for you. Those of you that are already existing, this was just a little refresher. If you're an existing integrated practice, then treating Medicare patients, then you are required to have a Medicare policy and procedure manual. So we've created one for integrated practices that see Medicare patients. Medicare policies and procedures are required if you see Medicare patients. It's not optional. Some examples of a Medicare policy and procedure would be to do internal audits. So you'd have to do a self-check. Going to the Medicare exclusions list to see if anybody that you're employing has been excluded from the Medicare program. If they have been, they cannot see Medicare patients. There's a website that you would have to go to and print out some items. You'd have to have written policies and procedures on how you bill and code for Medicare. So I would recommend every integrated practice that sees Medicare patients get a Medicare policy and procedure manual, also known as an OIG compliance plan. OIG stands for Office of Inspector General. And also, we've created HIPAA compliance programs for integrated practices. This way, you have a medical doctor coming in, a physical therapist, seeing your patients, entering into your software program. Everybody has to be in agreement. Everybody has to read the policies. Everybody has to sign off. A security risk assessment must be done. You want to train everybody on changing passwords and protecting patient health information. So we've created a very nice HIPAA compliance program for integrated practices. So just a few closing comments. Check with all the carriers you bill prior to submitting claims to ensure that it is compliant. We can't guarantee that this information will guarantee payment from any insurance company or patient, and we are not responsible for any changes that may occur following this presentation. And you know they change all the time. So it's important to do your best to stay on top of these changes by attending seminars, webinars, and join your national and state professional associations. Now, I mentioned this Medicare compliance manual, just a little bit more information about it. It's a comprehensive, customizable Medicare compliance policy and procedure manual. We personalize the policies and procedures for your practice. We provide you with all the chart audit tools, sample training logs, articles, links, reference material. Our HIPAA compliance program is very comprehensive. It's a concierge type of service. It costs more than most others, but we do a lot more. So, it's one of those sayings, you get what you pay for. We do most of the work for you. It's a cloud-based product where you could store all of your HIPAA policies and procedures in the cloud, plus we give you a hard copy 3-ring binder, so you get both hard copy and digital. We have about 20 videos that you could watch, and you could have your staff members watch these training videos, and they can sign off that they've read it, they understand them, and they watched them. They can get a little certificate of completion. We help you track your business associates. So these are a couple of the things that we do here at Target Coding. There's also a book that I've written on the best chiropractic ICD-10 and CPT codes to improve reimbursement. And what it does is it shows you how to pair your procedure codes to your diagnosis codes and how to choose long-term treatment diagnosis codes, which will pay much more than short-term treatment diagnosis codes. And there's a few of these really cool cheat sheets that are in the book, and then we also have you take a look at these. We put together about 25 diagnosis codes, and we show you how to justify the diagnosis codes you choose via ortho, neuro, and chiropractic tests. So, for example, you may diagnose a patient, you or your medical doctor, or your physical therapist. This isn't for chiro only. Cervical brachial syndrome can be diagnosed by an MD, a DC, a DO, a nurse practitioner, or a PT. So what ortho, neuro, chiro test should be done? Well, we have that quick little summary. If you're going to diagnose a patient with cervical brachial, do Wrights, do Atsons, check reflexes, look for myotomal weakness, look for forward head posture. So we have them for cervical problems and lumbar problems and extremity problems. Oh, we also have a FAQ section of the book. I know doctors in practice 15, 20, 25 years, and they don't know the difference between a disc disorder and a disc displacement. These are some of the common questions I've gotten over the years, and I've put them together in this section of the book. Like, I always get this question, Dr. Kotler, what's the difference between cervical brachial syndrome and cervical radiculitis? What's the difference between spasm and contracture? What's the difference between myalgia, myositis, and myofasciitis? What's the difference between effusion, swelling, edema? What's the difference between radiculitis, radiculopathy, myelopathy? So that's a nice section of the book. Now, we also do seminars and webinars. We have a whole bunch of seminars coming up. We also offer memberships. Those of you that like to become part of our family, we have a base membership. It's $99 a month. You pay as you go. You can stop and start at any time. Now we also offer a gold membership, which is a comprehensive review and ongoing trainings throughout the year. This is a 1-year program. And then we also offer a platinum membership. Our gold membership is our most popular. And then we can also do a free coding and compliance evaluation with you, 15-minute phone call. Let us know if you're interested in that. Here's our contact information, email info@targetcoding.com. Website targetcoding.com, telephone number 1-800-270-7044. Our HIPAA secure fax number is 1-844-831-2347. I want to thank everybody for attending. I hope you learned a lot.